Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Thank you for joining us today. Excessive amounts of blood transfusions have been recently found to be one of the most common medical errors. In a world where medical errors happen every day, it's kind of surprising that transfusions would be considered an error. Our guest in studio today is Mr. Joe Thomas, registered nurse, and he's here today to talk with us about a nationally recognized program that he developed and is built around safer, more evidence-based blood utilization. Welcome to Health Professional Radio, Joe.
Thanks for having me, Neal.
Thank you so much. We're talking about blood transfusions. This shortage that we're experiencing, is this something that we've seen before?
Yeah, we see blood shortages periodically, and I guess many in the blood industry would argue we've always got some type of shortage, whether it be a specific blood product or a specific blood type. But oddly, there have been some cries for help from some of our largest blood providers, like the American Red Cross, that we are really experiencing one of the worst blood shortages that we've seen in a while. And it's always for a variety of reasons, but summertime never helps. Some of the Zika virus today and some of the concerns we have, which has actually shut down collection in certain parts of the country. This along with the significant reduction in blood use causing blood providers to have to shift their practices of collection. All of this together has really contributed to, again, one of the worst blood shortages we've seen in a while.
Now, you've got experience in both critical care nursing and patient blood management. How did you go from critical care nursing to focusing exclusively on blood management?
Yeah, I think, as I said in the earlier interview, sometimes your career chooses you. You don't choose it. So I was a very happy cardiothoracic ICU nurse at the Cleveland Clinic. And really due to a chain of events that sort of shaped my career, I was given an opportunity to pilot a program within that health system around bloodless medicine and surgery, really a novel program at that time. And again, to keep it short, over the years, it expanded into patient blood management, and I was able to serve as the director of that program within the Cleveland Clinic health system. Ultimately given a chance with really a nationally recognized anesthesiologist, Dr. Tim Hannon, to help him with a startup consulting and analytics company in 2007, and then given a great opportunity by Acumen to really lead their effort around patient blood management. And that over the past 14 years, I arguably have as much, if not more, experience than anyone in the world in implementing patient blood management programs, as I've now worked with over 160 hospitals over that 14-year span.
So basically, you've become an expert in patient blood management. You've used that term several times. What exactly is patient blood management, and does it differ at all from just, I guess, regular blood management when the bloodmobile is rolling down the street?
Sure. No, it's a fair question. I'll start it, I should say, with a provocative statement. And that is, first of all, I believe, and I'm not the only one, but many of us believe that patient blood management is one of the 5 most important patient safety initiatives of this decade. And that's a powerful and certainly provocative statement. So patient blood management is more than simply managing a blood product or a collection of a blood product. It is what we would call vein to vein transfusion safety. So from the vein of the donor to the vein of the recipient, it's the right patient getting the right blood product at the right time for the right indication in the right dose. And I would arguably kind of summarize patient blood management as a couple of things. Number one, evidence-based use of blood products, safe transfusion therapy. And one area that often gets neglected, but I think one of the most important aspects of patient blood management is simply that, better management of the patient's blood within their body. So establishing proactive strategies that are designed to eliminate or at least reduce the risk of transfusion. And I'm sure we'll talk about those, like anemia management, minimizing bleeding and blood loss as some examples.
Now, better management often requires, better utilization of finances. Efficiency is one thing, but are we talking reduction in cost and efficiency, or are we trading out one for the other? Are we going to spend more for better management?
Great question. This is actually one of those programs that probably overused statement, win-win. Mm-hmm. So we know that the better management of patients' blood or blood products, it certainly is preserving a precious and scarce resource. So it's great for the community. But blood products aren't, free. It costs hospitals in the United States billions, and that's with a B, billions of dollars to purchase blood products. And that's just to get them through the front door. It costs billions of additional dollars to actually transfuse those blood products, process them, and test them. So yes, for those two things that you just said, it is going to be certainly better utilization of a precious resource. It is going to often save a hospital millions of dollars. But most importantly, Neal, why we care so much about this nationally today is that patient blood management is better for the patient. It actually has been shown to reduce the incidence of a variety of complications, improve patient outcomes, and it truly is the standard of care today, or the best available care that we can provide our patients. So that win-win of saving dollars and improving the quality of care, and that's awesome.
Now, you mentioned having the opportunity to head up a novel program some time ago, but working with Acumen, you've developed a program that is well on its way to being instrumental in patient blood management. Talk about this program, please.
Yeah, absolutely. So, it was a lot of fun early in my career to do this at one hospital or one, hospital system, certainly one as recognized as the Cleveland Clinic. What I'm really proud of and what we've built at Acumen is not only the people, but the process and the technology to work with not only one hospital system, but multiple hospital systems. In fact, at the last time I counted, I think we now are currently working with around 70 different hospitals across the country. So that's, I think, what certainly pleases me is the ability to, through Acumen, have an impact on patient blood management nationally, and arguably even internationally. And so you go back to what I just said a moment ago, really what Acumen provides as the leading provider of patient blood management solutions is nothing's magical, but really providing all of those tools and the resources that are immediately available to help a hospital or a health system rapidly accelerate their patient blood management program implementation. Whether it's a new program or whether there's already something in place, we work with both. And like we typically state at Acumen, we provide the people, again, over 75 or I think it's 85 years of collective experience doing this, 160 hospitals over the last 14 years. We have the process, those playbooks, those specific plans, having done this so many times to successfully and efficiently implement these programs. And then we have the technology, really the analytics, the benchmarks, and the data to be able to rapidly change practice and provide our hospitals and providers the tools they need, again, to implement a successful program and change clinical practice.
Do you always find that the current blood management methodology is always inferior to the new? Or in your experience, have you found that, well, maybe a piece of my program coupled with what they've already got will provide that efficiency and the savings in an adequate manner?
Yeah. So, Neal, I think your question is well taken. It's not so much that Acumen's model is or that the hospital's model was inferior. I would say almost every hospital today in the United States is doing something around patient blood management. But what they're missing often is that to really and successfully implement a comprehensive program, it requires dozens of different components. And most hospitals only have either the time, the resources, or the expertise to implement some of those components. So I'm going to give you one example. most hospitals today have changed their guidelines around the thresholds for when to order red blood cells. They've implemented guidelines. Maybe they have some process to review or educate around those guidelines. But that's often where hospitals' efforts end, mainly due to not a lack of knowledge or interest, but simply a lack of resources, time, and expertise. So, for instance, we're working with a number of health systems that already had, I think, a very good program in place. What Acumen is going to do with them is take their program from good to great. We're going to focus on better platelet utilization, plasma utilization, cryoprecipitate. We're going to work with their teams to implement anemia management programs and preoperative anemia management programs. We're going to work with each of their high blood use specialties like cardiac surgery and trauma, critical care, to minimize bleeding and blood loss, and working with their pharmacy, their quality department, as well as to provide really effective and meaningful data and analytics, which will then help us prioritize where the focus needs to be and help us to show physicians and specialties that they report to where those opportunities for improvement are. So all of that is kind of Acumen helping hospitals go from good to great, helping them to go from a blood management or a red blood cell management program to a comprehensive patient blood management program.
And where can our listeners get more information about Acumen?
Acumen.com. And certainly Google us, the nation's leading provider in patient blood management analytics and services.
You've been listening to Health Professional Radio. If you're just joining us, we're in studio today with Joe Thomas, registered nurse and also currently Regional Director of Patient Blood Management for Acumen. It's been great having you here with us today, Joe.
Thanks for having me, Neal.
Thank you. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. And you can subscribe to this podcast on iTunes.